All right, and we want to show who would be a candidate for this HIPEC procedure, if you will, and we have a list right there. Had a recurrence outside of 6 months since original diagnosis, gentlemen. Cancer is confined to the peritoneal cavity, can tolerate a major surgery with additional anesthesia time, and cancer has been receptive to chemotherapy in the past. Can we chime in on those?
Yeah, so again, every time we evaluate a patient for any kind of treatment, we always try to get a sense if their disease process matches up with the treatment we have to offer. We know that patients who present with somewhat more indolent disease, patients who've had stability disease over a longer period of time, those are patients that we can be surgically more aggressive with. So it's important to see patients who have had disease presentation and have been living a while with a certain volume of disease before we go in and do a radical operation only to see this continue to progress. Patients who have disease that's confined to peritoneal cavity, it's an important concept, because if we start doing this procedure on patients who have disease outside the lungs, the liver, brain, then clearly just addressing the peritoneal cavity aggressively isn't going to address those other areas.
Correct.
And it can be a large operation. These patients can be debilitated. So we need to make sure that the patient can tolerate the anesthesia and the surgery. Sometimes operation can be short, maybe an hour, hour and a half. We've had operations that have been 7, 8 hours.
Oh, wow.
And in addition to that, we're looking at about 90 minutes of the heated chemotherapy post-operatively. So, it can be an entire day event. And if you're not strong enough to tolerate that, then clearly the surgery wouldn't be of benefit.